Hello, this is an interesting surgical video that you can do in your office, a soft tissue dental biopsy. What patients do you see that need these biopsies? It's patients generally that have dipped, snuffed, chewed tobacco, or smoked for an extended period of time. I just diagnosed a patient a few months ago that had squamous cell carcinoma in the right mandibular vestibule. He had dip snuff for 30 years. And what do you see when you look in the mouth? You should do a soft tissue examination of every patient you see, especially if they've dipped or smoked. And what you're looking for is white tissue called leukoplakia. That's a precancerous change. Now, the patient with squamous cell carcinoma had an area that looked like an eruption or looked like an abscessed tooth with a big fistula. And so you can't be deceived by that and think it's an abscessed tooth. Get the history. My father was a general practitioner, medical doctor. He said if you listen to your patients, they'll tell you what's wrong with them. So if somebody's been dipping or smoking for a long time, you really need to do a thorough soft tissue examination. If there's leukoplakia, do a biopsy. So this gentleman had dipped snuff for 30 years. See, this is his mandibular vestibule in the anterior. See that soft tissue change? That's called leukoplakia when it turns white like that. You can see the white area. Now, where do you want to be careful? The only place you really need to be careful when you're taking a soft tissue biopsy is in the second bicuspid area, the mandibular second bicuspid, because of the middle nerve. If you lacerate the middle nerve, you can give a patient paresthesia. Anywhere else, you really don't have to worry about paresthesia or damaging anything. Nowhere in the maxilla, posterior mandible, anterior mandible, those places are fine. But the second bicuspid area and the teeth adjacent to it, the mandibular first molar, first bicuspid, be careful because of the middle foramen and the middle nerve. So you want to take a deep and broad biopsy. When I was in my oral surgery fellowship, we saw a lot of precancerous change, and the pathologists always like to have a deep section and a broad section. So this is a 15 blade, and I'm cutting all the way down to the bone, all the way through the periosteum. It's a full thickness biopsy. And so since he's got this leukoplakia all across the anterior, I'm cutting down the bone and then making a V-shaped wedge to get a nice section of tissue. And that sutures nicely. It'll heal very well. The patient won't have any trouble at all. So I'm taking that whole section from cuspid to cuspid, all the way down to bone. If you can picture a V-shaped wedge, and just be sure you get a deep cut so they've got plenty of tissue. I send these to Baylor College of Dentistry because they're used to looking at oral cancer. This is 3-0 gut suture. That tissue sutures well. Shouldn't be much bleeding once you suture it. And when I'm suturing, I like to go 1, 2, 3, pull, 1 toward me, pull, 1 away from me, pull. If you just go 1, 2, it sometimes doesn't suture as tightly, and the knot doesn't hold. If you go 1, 2, 3 away from you, pull, 1 towards you, pull, 1 away from you, pull. And you like to suture into attached gingiva on the coronal part of the incision. Of course, there's not any attached gingiva in the apical part of the flap of the incision. And I like interrupted suture just in case the suture tore loose or something happened to it, the whole suture would not come loose. You can use, interrupted suture means each suture is individual sutures. So this suture will dissolve in 4 to 7 days, and that's plenty of time for healing. Now tell the patient, don't pull on your lip, just leave it alone. Probably don't bite anything with your front teeth for several weeks, and don't eat or drink anything real hot or crunchy for a week or two. Sutures nicely. So here's the pathology report. Soft tissue specimen consisting of keratinized mucosa. The specimen is covered by stratified squamous epithelium, which shows parakeratosis. That's just precancerous change. Cellular maturation, however, is normal, and the cells show no cytologic atypia, meaning no cancer. The lamina propria consists of fibrous collagen suspending small vascular channels. In other words, no cancer. So the diagnosis was hyperparakeratosis, which is basically leukoplakia, which is precancerous change. You can see my clinical history, the patient nip snuffed for 50 years. It was a pink-white lesion, 2 by 2 inches. Tissue was not smooth, and I always send photographs with the specimen. And my provisional diagnosis was leukoplakia, which is basically hyperparakeratosis. That's the Dental Minute. These techniques work, and they work every time.
Are you ready to take your dentistry practice to the highest level possible? Of course you are! Subscribe right now to dentistrymasterclasses.com, where you will get Dr. Cutbirth's greatest work and best cases. Here's what you're going to get when you subscribe to dentistrymasterclasses.com. Incredible comprehensive cases not seen in Dental Minute videos. You will get an organized library of all the Dental Minute videos and Dentistry Masterclasses, comprehensive cases for study and reference, before and after photos of Dr. Cutbirth's fantastic restored cases. And all of this, I repeat, all of this is just $40 a month. This is something you cannot pass up. Subscribe right now to dentistrymasterclasses.com.